This is Steve Berger, and I will be discussing the diagnosis module, in particular, how to interpret the screen. There's a lot going on here. So let's put in a case. We have someone who's got diarrhea, and the patient is in, you see, and when we put up diarrhea, the program is asking me what else referable to the abdomen, but we need not get into that right now. And we'll say it's a patient in Finland. And Gideon tells us that the differential diagnosis of diarrhea in Finland consists of 81 diseases. Now, the list that you're seeing is 100% sensitive and 100% specific. What does that mean? It means nothing is missing here. Every possible infectious disease associated with diarrhea in Finland is listed. And by specificity, I mean nothing is included that would not be relevant. In other words, it's only diarrhea diseases. Having said that, that's a rather long list, certainly not good for making a diagnosis. And the point here is that Gideon, in fact, never makes a diagnosis. This is extremely important. What Gideon does is it presents a ranked differential diagnosis. The diseases that can cause diarrhea are listed. They are then reordered according to how common each disease is, in the case in Finland, and how common is the symptom in each disease. So Gideon is saying, well, Campylobacter infection is extremely common in Finland and essentially always is associated with diarrhea. And there is mathematics behind this. It's called Bayesian analysis. Having said that, Gideon is listing the diseases that might be associated with this specific patient. Now, obviously, the patient may have campylobacteriosis, and intuitively, you would know that amoebiasis, which is also associated with diarrhea, is less common in Finland and not always associated with diarrhea. So you can see the ranking is based on how common is the symptom and how common is the disease. As I said a few seconds ago, Gideon is not saying that campylobacteriosis is the diagnosis. I stress this because people have reviewed Gideon in the literature, and they've looked at these lists and said, well, here in a case like this, here Gideon is saying my patient now has campylobacteriosis, but in fact, I put a patient in, and my particular patient, in fact, had shigellosis. So Gideon didn't perform that well. This is what the papers will say. Gideon is not saying this is the diagnosis. And in fact, as I'll show you in a second, Gideon agrees with the author. In other words, it's not making the diagnosis. How do we know that? Gideon is saying that 29% of people with these symptoms, in this particular case, one symptom, 29% of patients with these symptoms can be expected to have campylobacteriosis. And if you think about it, Gideon is saying, in essence, that 71% of people with these symptoms do not have campylobacteriosis. Gideon agrees with the author. This is not the diagnosis. Only 29% would be expected to have that disease. If you add the first two together, you find something interesting. You see 29% would have this, and 28% would have viral gastroenteritis, meaning that more than half of patients would be expected to have one of these two diseases. You could make that statement. As we look at this list, there are two other things that are helpful. Gideon is listing things that you may not have thought of, and people using the diagnosis module will look at this list and say, oh yeah, I should also look for Giardia. Now, Gideon is giving them suggestions for other things that you might look for in a specific patient. And Gideon even will list things that are not at all common in infectious disease. So it's telling you, look for plesiomonas infection. Now, I suspect that most people seeing this video would not have thought of plesiomonas infection, but it does occur in Finland. and it produces certainly diarrhea. And if you wanted more information on this or any other disease, you can click on these little buttons and find out what is that disease, what are the signs and symptoms, the mortality rates, where does it occur in the world, and anything else, and specifically, how does it occur in Finland. The problem here is, again, 81 diseases. Now, you're not going to sit with this patient and go through the whole list and look for every disease. And how do we shorten the list? And putting a set of signs and symptoms into GIDEON should always be the process that you're using without the computer. You would not say to a patient, you have diarrhea, and therefore this is what you have. You would say, well, you have diarrhea. Do you have blood in the stools? Do you have leukocytosis? Is fever present? And every additional sign or symptom that you put in in this box or in the other boxes that appear with GIDEON will shorten the diagnosis. If we say fever with diarrhea, well, how many of those are there? We'll put that in. And now it's 73. We've eliminated several diseases. If we say the person has eosinophilia or a large spleen or anything else, this number starts becoming reasonable, if you will. And in fact, you'll find that between the first and second diseases, the numbers grow far apart. In other words, it becomes more and more specific for the first disease. Again, it's not making a diagnosis, but the first disease becomes more realistic. Down here, we said that the person was from Finland. If we erase Finland, we'll get a very long list, of course. Another very useful tool in diagnosis is incubation period. If we are speaking of someone who went to Finland and came back and developed diarrhea, putting in the dates of exposure and travel, and you have that option here. When did the exposure begin? In other words, when did the person go to Finland? When did they come back? And when did the disease appear? Or in the case of diarrhea, it would be useful to know when did the person eat a suspicious food. Let's say we have a group of people, we can put that in as well. A group of people who ate a specific food at a banquet, let's say, and then they all got diarrhea, or many got diarrhea. And having put in the incubation periods, this list becomes extremely, extremely small. There's several other options which we need not look at now, but we can ask a question, why not? We've looked at this list, and then you say, the doctor will say, well, why is such and such not listed? I don't see the disease that I was looking for listed among the differential diagnosis. If you ask why not, and I won't go into the screen, but you'll say, why is this not anthrax, for example? If you write in anthrax, GIDEON will tell you, well, that perhaps it's not in Finland and perhaps the symptoms do not apply. First case is an interesting option in GIDEON. First case says, well, there are diseases out there which cause diarrhea in this case, but which do not occur in Finland. They occur in other countries, but not in that specific country which I'm looking at. And you can look up that list as well. It will list all of the causes of diarrhea, let's say in Togo or in Eswatini or in Puerto Rico or what have you. Same symptoms, but not in Finland. And we call it the first case scenario because this often happens to us as a programmer. We will encounter a disease which had not been reported until a publication we're looking at, let's say today, and we will change this the same day. In other words, it now becomes a disease of Finland because it has now appeared in Finland. One example in the history of GIDEON was when West Nile fever came to America, it was not diagnosed. Cases were reported in the area of New York of an interesting disease. And the local people and even the CDC initially thought that this was St. Louis encephalitis. When this happened, we were actually presenting GIDEON at the World Health Organization, and they said to us, well, it's not St. Louis encephalitis. We have new information. This is West Nile fever. Wouldn't it be nice to have that option in GIDEON? In other words, what could it be if it's the first case? Everything we're looking at can be emailed and downloaded for our students, perhaps. One other place that you see the Bayesian diagnosis, strangely enough, is in bacteriology. I'll show you something because you'll see it looks exactly like what we've been looking at. Let's say we have an organism. This is now bacteria. And the organism has a phenotype. It has certain laboratory tests that appear in the laboratory. And we've treated the phenotype for a bacterium as we just did for symptoms and signs in the diagnosis list. So this organism is gram-negative, let's say, and it is a coccus, and it's, let's say, anaerobic. And there's the list. And if you have a gram-negative anaerobic coccus, those are, again, the symptoms of the organism. What is it suffering from, if you will? And the first organism to think of would be Veillonella. This is not what it is. The chance of it being Veillonella is 52%, which is pretty good. In other words, if you saw 100 such organisms, 50 would turn out to be Veillonella. Veillonella parvula, which is the common species. So this is how we do diagnosis in GIDEON. One other feature in diagnosis and in bacteriology is the ability to alphabetize the list. And as simple as it sounds, that's a very useful teaching tool. Go back to diagnose, and we'll put in our patient, again, with, let's say we have a patient with hypereosinophilia. This is a good one. So I'm putting in one finding. We're not putting in the country in this case, and we're taking away diarrhea. That's not relevant now. And GIDEON is saying this is the differential diagnosis of eosinophilia. There are 14 diseases that do that. If you alphabetize the list, this is the, again, the differential diagnosis of hypereosinophilia. But isn't that a nice teaching slide for your fellows and students and residents? These are the causes. What is the differential diagnosis of hypereosinophilia in Kenya? How many diseases are in Kenya? Because, of course, we were looking at the world before. There are 5 diseases in Kenya associated with hypereosinophilia. Or the United States, put in the United States. And how many will you suppose are there? There are there are 6 diseases in the United States associated with, which could be associated with hypereosinophilia. And again, there are things on the list. Many of you are in the United States. Did you know that metorchiasis is a disease of that country, and that not only that, but it causes hypereosinophilia? And you can look up the details in these buttons here.